guys, so in wound healing, what did you see? You saw that there is hemostasis, inflammation, proliferative phase, remodeling phase. Then you have a scar, right? A scar can be there. A scar here can be so many types. Look at this. You have seen hairline scar, etc. in primary intention. Look at this one here. You have some other types of scars like atrophic scar, hypertrophic scar, and keloid. Atrophic scar is where there is actually loss of epidermis and dermis. Okay, so it has become atrophy. So this is an atrophic scar, but there can be some other scar where there's more growth. Like you can have a hypertrophic scar and a keloid. Okay, let's look at this. This, guys, is a hypertrophic scar. See, only wherever there was the incision or wherever the wound, only there it has kind of risen, right? Only the height has increased, only within that area of the wound. So this is a hypertrophy scar. Okay. Now look at what keloid is. Keloid is beyond the area of wound. It is going beyond that. Okay, so you can see this is a keloid. It is going beyond your wound margin. So did you understand atrophic, hypertrophic, keloid? Atrophic, it is opposite of hypertrophic and keloid. That much you have understood, right? So look at this hypertrophic scar. It starts after a few weeks, okay, and it can grow up to 6 months. After that, it will not grow much, they are saying. And it is well organized type 3 collagen. It will be kind of raised. It will not go beyond the boundary of the original incision or wound, okay. It rises above skin, they have written here. So why does this happen? Prolonged inflammatory phase. So you know the phases of wound healing. In that, inflammatory phase will be prolonged, okay. Now, what else you can see? This you can see mostly over the sternum and over the joints, flexor surfaces. They are saying in children this can happen more in the hypertrophic scars. So they can also become small by themselves, okay. And treatment sometimes you need not do, but they are telling that you put elastic bandage or stocking or armlets or gloves. It will help. I'm thinking they're planning to put some pressure so that it doesn't rise above. So otherwise, if it doesn't go away, you can do an excision, silicone application they are talking about, or topical retinoids also they are talking about, okay. Then now we are moving to keloid, guys. So you remember how keloid looks, right? Do you remember, or you forgot how keloid looks? Where is the keloid photo? See, keloid, we have a separate video already from a pathology, I think. So this is a keloid. So what have you seen about it already in life? It is persistent excessive growth of scar beyond the margin into normal skin. It is growing, and it starts after 3 months and it progresses. So years and years it can grow, okay. And what are you seeing here? It is itchy, okay. It is kind of painful also, they are saying. And this type 3 collagen, look at this, blood vessels also will be there. That's why it's growing and growing, isn't it? And it's very difficult to treat. And this is a common area where it occurs, sternum and earlobe. And how to treat steroid injection they are talking about, then that is triamcinolone. And they are talking about laser therapy, vitamin E excision, but this will recur, okay. This is controversial because they're saying it will recur. Very high chances of recurrence is there, okay. So keloid, look at this, it continues to get worse. Severe itching is present, vascular it is, so that's why it continues to grow, isn't it? It extends to normal tissues also, like claw. That is why keloid name. And it is seen more in blacks, people who have dark pigment. Where do you usually see it? In that sternal area, that triangle ear lobe. Then it is usually familial. People who have lot of growth factors also it can happen. So they are having lot of growth. That's what it is. This does not become small. It but if you excise, it will have a recurrence. So anyways, the only thing they're telling is triamcinolone steroid preparation they want to inject. And if it doesn't go away, they're calling it as some refractory keloid, okay. Same thing, silicone application, topical retinoids they are telling for keloid. So look at keloid here. This is that triangle which they are seeing, right, where it occurs more, isn't it? This is the chest area. So here you can see a keloid over vaccination site. Hope you have understood the differences between hypertrophic scar and keloid. Bye bye.